Have you ever felt an itch that just wouldn't go away? One that lingers, nags, and makes you wonder if it's more than just dry skin. For older adults, that persistent itch in specific spots could be your body whispering a warning, sometimes about something as serious as cancer. Today we're diving into a topic that might surprise you, how a simple itch could be an early clue to something far more serious. In this video, we'll uncover 5 specific places on your body where persistent itching might signal cancers like lymphoma, pancreatic cancer, or breast cancer, sometimes months before other symptoms show up. But this isn't about scaring you. It's about empowering you with knowledge, why these itches happen, how to tell if they're more than just a skin issue, and exactly what to do if one feels familiar. By the end, you'll walk away with 3 key things. First, a clear understanding of which itches need your attention. Second, simple steps to check yourself at home. And third, the confidence to talk to your doctor without hesitation. Because when it comes to your health, noticing the small things can make the biggest difference. Let me share a quick story. Mary, a 68-year-old grandmother from Ohio, thought the itch on her lower legs was just part of getting older. She tried every lotion, changed her soap, even blamed the dry winter air, but it kept coming back, especially at night. One day her daughter urged her to see a doctor, saying, "Mom, it's been months, let's just check." That simple decision led to a blood test, and then a diagnosis: early-stage lymphoma. Today, Mary's in remission, playing with her grandkids, all because she listened to her body's quiet signal. I want you to think for a moment. Have you or someone you love ever brushed off an itch that felt off? Before we dive into the details, let us explore together why your body might be trying to tell you something important and how you can act on it. But first, I want to share why these subtle signs matter so much, especially for those of us over 50. Stay with me, because this could be the knowledge that changes everything. So imagine waking up every night scratching your lower legs, thinking it's just dry skin or a new detergent. But what if that relentless itch is your body's way of signaling something far more serious, like a blood cancer? Let us uncover why an itch in this specific spot could be a clue you can't afford to ignore. Let us start with a place many of us don't think twice about: the lower legs, especially the shins and calves. For older adults, a persistent itch in this area, one that lingers for weeks, doesn't come with a rash, and doesn't get better with lotions, can sometimes be an early warning of blood cancers, particularly Hodgkin's lymphoma. This isn't the kind of itch that comes and goes after a hot shower. It's deep, almost burning, often worse at night, and it feels like it's coming from under the skin, even when everything looks normal on the surface. So why does this happen? The science behind it is fascinating yet straightforward. Blood cancers like lymphoma start in the lymphatic system, a network of vessels and nodes that acts like your body's drainage and defense system. When cancer cells multiply in this system, they can release inflammatory chemicals called cytokines into your bloodstream. These chemicals irritate the nerves under your skin, especially in the lower legs, where blood flow is slower and nerves are more exposed. The result? A stubborn itch that no cream can soothe. According to the American Cancer Society, about 1 in 3 lymphoma patients reports this kind of itching as one of their first symptoms, often months before other signs like swollen lymph nodes or fatigue show up. Let me tell you about George, a 75-year-old retired teacher from Pennsylvania. For nearly 6 months, George dealt with an itch on his shins that drove him crazy. He'd slather on moisturizers, switch soaps, even try oatmeal baths. Nothing worked. At night, the itching got so bad it kept him awake, and he started to wonder if it was just part of getting older. But his primary care doctor, Dr. Ellis, had seen this before. She shared at a cancer awareness event that George S. case wasn't unique. So many patients over 60 come to me with persistent itching, and we often dismiss it as dry skin. But when George's blood tests showed abnormal white cell counts, we dug deeper. A scan revealed swollen lymph nodes in his chest, and a biopsy confirmed Hodgkin's lymphoma. The good news: because George spoke up, his cancer was caught early, and today he's in treatment, feeling hopeful, and still teaching his grandkids how to fish. Now let's compare this to a typical itch. If you've got dry skin, maybe from winter air or a new lotion, it usually comes with flaking, redness, or a clear cause, and it gets better with moisturizers. A cancer-related itch is different. It's relentless, often one-sided, and paired with other subtle clues like night sweats, unexplained weight loss, or feeling more tired than usual. For older adults, these signs can be easy to brush off. After all, who hasn't blamed fatigue or dry skin on aging? But here is the key difference. If you've tried lotions for 2 weeks, and the itch is still there, especially if it's keeping you up at night, it's time to talk to your doctor. One big mistake is assuming this kind of itch is just a normal part of getting older. Many folks in their 60s or 70s think, my skin's always been dry, or it's probably the weather, and they wait too long to get it checked. Another mistake is not mentioning it to your doctor because it feels too small to bother with. But trust me, no symptom is too small when it's persistent. If an itch on your lower legs lasts more than 2 weeks, doesn't respond to moisturizers, and feels deeper than the surface, don't wait. Ask your doctor for a complete blood count test, or CBC, to check your white blood cell levels. If there's something more going on, like lymphoma, catching it early can make all the difference. And don't be afraid to speak up. Your doctor wants to hear about these things. I believe our bodies are always trying to talk to us, especially as we get older. An itch might seem like a small annoyance, but it could be your body's way of waving a flag, saying, hey, pay attention to me. For those of us over 50, listening to these quiet signals isn't just about staying healthy. It is about giving ourselves the chance to enjoy more moments with the people we love. George's story reminds me that a simple conversation with a doctor can change everything. Now that we've uncovered why an itch on your lower legs could be a hidden clue, let us move to another surprising spot. One you'd never suspect could point to a completely different organ. Stay with me, because this next sign might just save your life. Why would an itch right between your shoulder blades, deep, nagging, and impossible to soothe, have anything to do with an organ you rarely think about, like your pancreas? Stay with me, because this surprising connection could be your body's way of sending you a life-saving signal. Let's talk about a spot we often overlook, the upper back, right between your shoulder blades. For many of us over 50, an itch in this area might seem like nothing more than dry skin, an old shirt tag, or maybe even a muscle strain from sleeping funny. But when that itch feels deep, like it's coming from under the skin, and it lingers for weeks despite every lotion or back scratcher you try, it could be a subtle clue pointing to something far more serious. Pancreatic cancer. Yes, it sounds surprising, an itch on your back tied to an organ deep in your abdomen, but the connection is real, and it's one doctors see more often than you might think. So, how does this happen? The pancreas, a small organ behind your stomach, plays a big role in digestion by releasing bile through tiny tubes called bile ducts into your intestines. When a tumor begins to grow in the pancreas, it can block these ducts, causing bile salts to build up in your bloodstream. These excess salts don't just stay quiet, they travel through your body and irritate nerve endings, especially in areas like the upper back, where there's a dense network of sensory nerves. The result is a persistent, deep itch that feels different from surface-level irritation. It's often worse at night and doesn't respond to typical skin treatments. According to the Mayo Clinic, this kind of itching can appear months before more obvious signs of pancreatic cancer, like abdominal pain or jaundice, making it a critical early warning for older adults. Let me share a story about Linda, a 70-year-old retiree from Texas. Linda started noticing a strange itch right between her shoulder blades about a year ago. She described it as a phantom itch. No rash, no redness, just a nagging sensation that woke her up at night. She tried everything, new lotions, a humidifier, even a new mattress, thinking it was the culprit. But nothing worked. Her daughter, Sarah, noticed Linda seemed unusually tired and urged her to see a doctor. At the appointment, Linda mentioned the itch almost as an afterthought. Her doctor ordered blood tests, which showed elevated liver enzymes, and a follow-up CT scan revealed a small tumor pressing on Linda's bile duct. Sarah later shared, "If Mom hadn't spoken up about that itch, we might not have caught it so early. She's in treatment now, and we're so grateful for every day we get with her." Linda H's story isn't rare. Many pancreatic cancer patients report this kind of itch as their first clue, long before other symptoms. Now let's compare this to a typical itch. If your back itches because of dry air or a scratchy sweater, You'll usually see flaking skin or feel relief with moisturizers. A pancreatic cancer-related itch is different. It's focused, often in one specific spot, and feels like it's coming from inside. It might also come with subtle signs like darker urine, pale stools, or unexplained fatigue. For older adults, these clues can be easy to dismiss, especially since we're used to chalking things up to aging or stress. But here's the key. If the itch lasts more than 2 weeks, doesn't improve with creams, and feels oddly deep, it's time to take it seriously. One common mistake is assuming this itch is just a skin issue or a result of something external, like weather or posture. Many people over 60 think, it's just my skin getting older, and keep applying lotions instead of seeking answers. Another mistake is waiting for more dramatic symptoms, like pain, before seeing a doctor. By then, pancreatic cancer can be harder to treat. If you've got a persistent itch between your shoulder blades that won't quit, don't ignore it. Ask your doctor for a blood test to check your liver enzymes or a CT scan to look at your pancreas. Pair this with tracking other symptoms, like changes in your urine or energy levels. Early action can be a game changer, especially with pancreatic cancer, where catching it early significantly boosts your chances. I truly believe our bodies are wiser than we give them credit for. That itch on your back might feel like a small nuisance, but it could be your pancreas sending you a quiet SOS. For those of us over 50, tuning into these signals isn't just about health. It's about protecting the moments that matter, like sharing a laugh with your kids or savoring a quiet morning coffee. Linda's story shows us that a little curiosity can lead to a lot of hope. Now that we've seen how an itch on your back could point to your pancreas, let us move to another spot that is easy to brush off, but could be telling a much bigger story, your scalp. Stay tuned, because this next sign might surprise you. Have you ever scratched your scalp, blamed it on dry air or a bad shampoo, but found no relief no matter what you tried? What if that nagging itch is more than just a skin issue? It could be your body hinting at something as serious as leukemia or skin cancer. Let's explore why your scalp might be trying to tell you something important. For many of us over 50, an itchy scalp feels like no big deal. We chalk it up to aging skin, a harsh shampoo, or maybe even a tight hat. But when that itch persists, week after week, with no visible flakes, redness, or dandruff, it could be a subtle signal of something deeper, like leukemia or skin cancer on the scalp. This isn't your typical itch that comes and goes after a good wash. It's a tingling, crawling, or even burning sensation that seems to move around, doesn't respond to anti-dandruff shampoos, and feels like it's coming from beneath the surface. So, what's going on here? Let's break it down. Leukemia, a type of blood cancer, starts in the bone marrow where your body makes blood cells. When leukemia cells multiply, they can disrupt your immune system, triggering abnormal inflammation that irritates nerve endings in places like the scalp. This leads to a deep, restless itch that doesn't match what you see on the surface. Similarly, skin cancers like melanoma or basal cell carcinoma can start as a small itchy patch on the scalp, especially in areas where hair is thinning, a common trait for older adults. According to the Skin Cancer Foundation, 1 in 5 Americans over 70 will face some form of skin cancer. And the scalp is a sneaky spot because it's hard to check on your own. Let me tell you about Henry, a 73-year-old grandfather from Colorado. Henry noticed his scalp itching every afternoon like clockwork. He tried switching shampoos, went hat-free, even asked his wife to check for lice. Nothing helped. He figured it was just dry skin, a normal part of aging. But at a routine checkup for unrelated fatigue, Henry mentioned the itch to his doctor. Blood tests showed unusually high white blood cell counts, and a bone marrow biopsy confirmed early-stage chronic lymphocytic leukemia. Henry's doctor later shared, that itch was his body's first red flag. We see this in older patients, but it's often dismissed until other symptoms appear. Henry's now in treatment and he's grateful he spoke up when he did. But here's another angle. A local hairdresser, Jane, once noticed a small itchy bump on a client's scalp during a haircut. She urged him to see a dermatologist, and it turned out to be early melanoma. That simple observation saved his life. Let's compare this to a typical scalp itch. If it's dandruff, you'll see white flakes, maybe some redness, and it usually improves with medicated shampoos. A cancer-related itch is different. It's persistent, often feels like tingling or burning, and doesn't budge with over-the-counter treatments. For leukemia, it might come with fatigue, easy bruising, or feeling off. For skin cancer, you might notice a small, rough patch or a mole that changes shape. Since the scalp is tough to inspect, especially with thinning hair, these signs can slip under the radar for older adults. One big mistake is assuming an itchy scalp is always a minor issue, like dandruff or a product reaction, and endlessly switching shampoos without digging deeper. Another is not checking the scalp regularly, especially for those of us with thinner hair where skin cancers can hide. Many people over 60 think to ask a doctor about a little itch because it feels trivial compared to other health concerns. If your scalp has been itching for more than 2 weeks, with no visible flakes or relief from shampoos, don't brush it off. Ask a loved one or your hairdresser to check your scalp for unusual bumps or patches. Then talk to your doctor about a complete blood count test for leukemia or a dermatologist referral for a skin check. Catching these issues early can be a game changer, especially for cancers that thrive on staying hidden. I believe our bodies are always trying to communicate with us, and as we age, those messages get quieter but no less important. An itchy scalp might seem like a small annoyance, but it could be your body's way of saying, "Hey, take a closer look." For those of us over 50, paying attention to these signals isn't just about staying healthy. It is about ensuring we have more time for the things that light us up, like storytelling with grandkids or enjoying a sunny afternoon walk. Henry's story and even Jane's sharp eye remind us that a little curiosity can go a long way. Now that we've uncovered how an itchy scalp could point to something serious, let's turn to a spot that's often ignored, but carries a powerful message: your chest. Stay with me, because this next sign could be a wake-up call you don't want to miss. Have you ever felt an itch on your chest or breast that just wouldn't quit no matter how many times you changed your shirt or tried a new lotion? What if that small irritation is your body's way of sounding an alarm about something as serious as breast cancer or lymphoma? Let's dive into why this spot deserves your attention. When it comes to itching, the chest or breast area is one of those places we often brush off. For those of us over 50, it's easy to blame a persistent itch on sweat, a tight bra, or even thinning skin that comes with age. But when that itch lingers, focused around the nipple under the breast or across the chest wall, and doesn't go away with creams or changes in clothing, it could be a quiet signal of something more serious like inflammatory breast cancer or lymphoma. This isn't the kind of itch that moves around or feels surface level. It's stubborn, sometimes warm or tight, and it might come with subtle changes in skin texture that you can't quite pinpoint. Let's unpack the science. Inflammatory breast cancer is a rare but aggressive form of breast cancer that doesn't always start with a lump. Instead, it causes inflammation in the skin, irritating nerve endings and leading to a deep, persistent itch. This can make the skin feel warm, slightly rough, or even dimpled, like an orange peel. Similarly, lymphoma, a cancer of the lymphatic system, can cause nearby lymph nodes under the arms or near the collarbone to swell, triggering itching in the chest area as a secondary effect. According to the American Cancer Society, inflammatory breast cancer accounts for about 1 to 5% of breast cancer cases, but it's often caught late because its symptoms, like itching, mimic less serious issues. For men, breast cancer is rare, about 1% of cases, but it's often missed because men don't think to check for it. Let me share a story about Ruth, a 69-year-old librarian from Wisconsin. Ruth noticed an odd itch around her right breast that wouldn't go away. She tried switching to softer bras, changed her detergent, and even stopped wearing anything tight, thinking it was irritation from friction. But the itch stayed, always in the same spot, and it felt deeper than anything she'd experienced before. Her husband, Tom, noticed she seemed more tired than usual and encouraged her to mention it at her next checkup. Ruth almost didn't bring it up, thinking it was too small a complaint. But when she did, her doctor noticed slight dimpling on her skin and ordered a mammogram. The results showed a small, aggressive tumor close to the skin's surface. No lump, just the itch as the first clue. Tom later said, "If I hadn't pushed her to speak up, we might have missed it. Ruth's in treatment now, and we're hopeful." Ruth's story highlights how this subtle sign can be a lifesaver if you act on it. Now let's compare this to a typical itch. If it's caused by sweat, a tight shirt, or eczema, you'll usually see redness, a rash, or flaking skin, and it improves with moisturizers or looser clothing. A cancer-related itch is different. It's relentless, often focused in one area, and might come with warmth, swelling, or a vague sense of heaviness in the chest. For men, it could appear near the nipple or under the chest muscle, which is easy to dismiss. If you notice these signs, especially alongside fatigue or swollen lymph nodes, it's time to pay attention. One common mistake is thinking an itch in the chest or breast is just a skin issue, like irritation from clothing or allergies, and ignoring it for months. Another is assuming breast cancer only affects women, so men often overlook these signs entirely. Many people over 50 hesitate to mention minor symptoms to their doctor, worried they're overreacting or wasting time. If an itch in your chest or breast lasts more than 2 weeks, doesn't improve with creams, and feels deeper than the surface, don't wait. Check for changes in skin texture or warmth, and ask your doctor for a mammogram or ultrasound, even if you're a man. For women, monthly self-exams can help you spot changes early. Speaking up about a small symptom can lead to catching something big before it grows. I truly believe our bodies are always trying to talk to us, and sometimes an itch is more than just an annoyance. It's a message. For those of us over 50, these quiet signals are easy to miss, but they're often the first step to protecting our future. Ruth's story shows that a simple conversation with your doctor can change the course of your life, giving you more time for the moments that matter, whether it is a family dinner or a quiet evening with your spouse. Now that we've seen how an itch in the chest could be a critical warning, let us move to a more sensitive area that's often too awkward to talk about, but ignoring it could be a mistake. Stay with me, because this next sign is one you need to know. Talking about an itch in a private area like your anal or genital region isn't too easy. It is the kind of thing most of us keep to ourselves. But what if that persistent itch, the one you've tried to ignore, is your body's way of whispering a warning about something as serious as cancer? Let's break the silence and explore why this sensitive spot could hold a life-saving clue. For those of us over 50, an itch in the anal or genital area can feel like one of the most awkward things to talk about. It's tempting to brush it off as a hygiene issue, a reaction to toilet paper, or maybe even irritation from sitting too long. But when that itch lingers for weeks or months, feels raw or burning, and doesn't improve with creams or better hygiene, it could be a subtle signal of something more serious, like anal, vulva, or penile cancer. These cancers are rare, but they're more common in older adults, and an itch is often their earliest whisper, sometimes long before more obvious symptoms like pain or lumps appear. Let's dive into why this happens. The skin in the anal and genital areas is packed with nerve endings, making it highly sensitive to changes in your body. Cancers in these regions, like anal or vulva cancer, can start with abnormal cell growth that irritates these nerves, causing a deep, persistent itch that feels different from surface irritation. For example, anal cancer might cause a raw, one-sided itch in the anal canal, while vulva cancer in women can lead to itching on or near the outer genital area, sometimes with slight roughness or discoloration. Penile cancer, though rare, can show up as an itchy patch on the shaft or foreskin in men. According to the CDC, vulva cancer rates have risen by 20% in women over 60 in the past decade, and anal cancer is increasingly seen in older adults. The itch often starts so subtly that it's easy to mistake for something minor, like hemorrhoids or a yeast infection. Let me tell you about Eugene, a 76-year-old retired mechanic from Oregon. For nearly a year, Eugene dealt with what he thought was hemorrhoid irritation. The itch in his anal area was relentless, especially at night. He tried over-the-counter creams, adjusted his diet, and even used cold compresses, but nothing worked. Embarrassed, he avoided mentioning it to his doctor, thinking it was just a normal old-age problem. But when his wife Clara noticed he was losing weight and seemed more tired, she insisted he get it checked. At the appointment, Eugene hesitantly described the itch, and his colorectal specialist ordered a scope exam. The result was a small lesion in the anal canal, an early-stage tumor. Clara later shared, Eugene felt so shy about it, but that conversation with the doctor saved his life. He's in treatment now and we're hopeful. Eugene S.'s story shows how easy it is to dismiss this symptom and how crucial it is to speak up. Now let's compare this to a typical itch. If it's caused by hygiene issues, a yeast infection, or irritation from clothing, you'll often see redness, swelling, or a clear trigger, and it usually improves with proper care or medication. A cancer-related itch is different. It's focused, often on one side, feels raw or burning, and persists despite your best efforts. It might also come with subtle signs like weight loss, changes in bowel habits, or a feeling that something's just not right. For older adults, these symptoms can be easy to ignore, especially in such a private area where we're hesitant to seek help. One big mistake is assuming this itch is something minor, like hemorrhoids or a skin reaction, and delaying a doctor's visit out of embarrassment. Many people over 60 think it's too awkward to mention, or it'll go away on its own. Another mistake is not connecting the itch to other symptoms like fatigue or changes in bathroom habits, which could point to something deeper. If an itch in your anal or genital area lasts more than 2 weeks, doesn't respond to hygiene changes or creams, and feels deeper than the surface, don't let embarrassment stop you. Ask your doctor for a physical exam or a referral to a specialist, like a colorectal doctor or gynecologist. Prepare a simple question like, could this itch be related to something internal? Early detection of cancers in these areas can significantly improve outcomes, and your doctor is there to help, not judge. I believe our bodies are always trying to tell us something, and even the most private symptoms deserve our attention. For those of us over 50, it's easy to stay silent about something as personal as an itch in these areas. But speaking up could mean more time for the things we cherish, like a quiet evening with family or a walk with a loved one. Eugene S.'s courage to finally talk to his doctor reminds us that no symptom is too small when it comes to your health. Now that we've broken the silence about this sensitive sign, let us explore why so many of us over 50 miss these warning signals altogether and what we can do about it. Stay with me, because this next part could change how you listen to your body.
Did you know that 70% of cancer patients over 60 miss their body's earliest warning signs? Like persistent itching simply because they think it's just part of aging? Why is it so easy for older adults to overlook these quiet signals, and how can we change that? Let's dive into the reasons and a powerful lesson that could save your life. As we age, our bodies change in ways that can make it hard to spot the difference between normal aches and something more serious. For those of us over 50, a persistent itch, whether on the legs, back, scalp, chest, or a private area, can easily blend into the background of life. We might think it's just dry skin, a side effect of getting older, or something too small to bother a doctor about. But when it comes to early cancer warning signs, like the itching we've been exploring, missing these signals can mean missing a chance to catch something serious before it grows. So, why do older adults in particular overlook these clues, and what can we do about it? Let's start with the science. As we age, our skin naturally becomes thinner and drier, which can make itching feel like a normal part of life. On top of that, our bodies don't always send clear distress signals the way they did when we were younger. According to the National Cancer Institute, 70% of cancer patients over 60 are diagnosed at a later stage because early symptoms, like itching, are dismissed as age-related or minor. This is especially true for cancers like lymphoma, pancreatic, or breast cancer, where itching can appear months before more obvious signs like lumps or pain. Add to that the fact that many older adults hesitate to visit a doctor for something that seems small, often out of fear of overreacting or because they're juggling other health concerns. Let me share 2 stories that bring this to life. First, there's John, a 67-year-old farmer from Iowa. For months, John ignored an itch on his lower legs, thinking it was just dry skin from long days in the fields. He was used to toughing things out, and didn't he want to bother his doctor with something so trivial? By the time he mentioned it, paired with fatigue and night sweats, tests revealed late-stage lymphoma. John's now fighting hard, but he wishes he'd acted sooner. Contrast that with Susan, a 62-year-old teacher from Michigan. Susan noticed an itch on her upper back and mentioned it during a routine checkup, almost as an afterthought. Her doctor ordered blood tests and a scan, catching a pancreatic tumor early. Susan's now in treatment and still teaching her beloved history classes. Her daughter later shared, "Mom's always been proactive about her health. That one comment to her doctor made all the difference." These stories show the power of paying attention and the cost of looking the other way. Now let's compare how older and younger adults respond to symptoms. Younger people tend to notice and act on unusual signs more quickly, often because they're less used to bodily changes. Older adults, on the other hand, might chalk up an itch to aging, medication side effects, or even stress. For example, someone in their 30s might rush to a doctor for a persistent itch, while someone in their 60s might say, "It's just my skin acting up again." This mindset, combined with a reluctance to make a fuss, can delay diagnosis, especially for cancers where early detection is critical. One big mistake is assuming that itching or other subtle symptoms are just a normal part of aging. Many people over 50 think, "I've always had dry skin," or "I don't want to waste my doctor's time." Another mistake is waiting for more dramatic symptoms, like pain or a visible lump, before seeking help. By then, cancers like lymphoma or pancreatic cancer may have progressed, making treatment harder. Don't let age or embarrassment keep you from listening to your body. If an itch persists for more than 2 weeks, especially if it's paired with fatigue, weight loss, or other unusual signs, schedule a checkup. Get a habit to get a full physical every 6 months. It's like giving your body a chance to speak up. Early detection can boost survival rates dramatically, with some cancers having a 90% 5-year survival rate when caught in stage 1, compared to under 20% in stage 4, according to the American Cancer Society. I believe that as we get older, our bodies become quieter, but no less wise. A persistent itch might feel like a whisper, but it's often your body's way of shouting for attention. For those of us over 50, taking these signals seriously, ICE and T just about health it. S about protecting the moments that make life special, like watching your grandkids grow or sharing a laugh with old friends. John and Susan's stories remind us that a small action, like a quick doctor's visit, can lead to a big difference. Now that we've seen why older adults often miss these warning signs, let's talk about how you can take charge at home with a simple 3-minute check to catch these clues early. Stay with me because this next part could empower you to act with confidence.
Can you spot a warning sign from your body in just 3 minutes at home? What if a simple checklist could help you decide whether that persistent itch is something to watch or a reason to call your doctor? Let S walk through an easy way to take charge of your health and know exactly when to act. We've talked about how persistent itching in specific spots, like your legs, back, scalp, chest, or private areas, can sometimes be an early warning of serious conditions like cancer. But how do you know when an itch is more than just a passing annoyance? And how can you take action without feeling overwhelmed? For those of us over 50, being proactive about our health doesn't require fancy tools or medical expertise. It starts with a simple 3-minute check you can do at home and knowing when to talk to your doctor. Today, I'm going to share a clear checklist to help you evaluate an itch, prepare for a doctor's visit, and understand what tests might come next. Let's start with a practical 5-step checklist to assess an itch. Step 1. Note the timing and location. Grab a small notebook or your phone and jot down where the itch is, say your lower legs or chest, and how long it's been going on. Is it constant or worse at night? Step 2. Look for visible changes. Use a mirror or ask a loved one to check the area for redness, bumps, or changes in skin texture, like roughness or dimpling. Step 3. Test for relief. Try a fragrance-free moisturizer or hypoallergenic soap for 2 weeks and see if the itch improves. Step 4. Track other symptoms. Are you feeling more tired than usual, losing weight without trying, or noticing changes in your urine or bowel habits? These could be clues. Step 5. Trust your instincts. If the itch feels deep, persistent, or just off, it's time to make an appointment. This checklist isn't a T about diagnosing yourself. It is about gathering information to have a confident conversation with your doctor. Here's a story that brings this to life. Anna, a 65-year-old retiree from Florida, started noticing an itch on her scalp that wouldn't quit. She followed a version of this checklist, writing down when it happened and checking for flakes or redness. There were none. She tried a new shampoo, but after 2 weeks the itch was still there, and she felt unusually tired. Anna brought her notes to her doctor and said, "I know this sounds small, but this itch isn't normal for me." Her doctor ordered a complete blood count, or CBC, which showed abnormal white cell levels, leading to an early leukemia diagnosis. Anna's daughter later shared, "Mom's notebook was like her secret weapon. It helped her explain everything clearly, and now she's in treatment with a great prognosis." Anna's story shows how a simple system can empower you to act early. So, what happens when you see your doctor? Be ready to share your checklist and ask specific questions like, could this itch be related to something internal? Or should we do a blood test or imaging? Depending on the itch's location, your doctor might suggest tests like a CBC for blood cancers, a mammogram for breast itching, or a CT scan for pancreatic concerns. These tests are straightforward and can rule out serious issues or catch them early. According to the American Cancer Society, early detection of cancers like leukemia or breast cancer can boost 5-year survival rates to over 90% in some cases, compared to under 20% for late-stage diagnoses. For older adults, being proactive is key, as our bodies often send subtler signals than they did when we were younger. One common mistake is dismissing an itch because it feels too minor to mention, especially if you're juggling other health concerns. Many people over 50 think, "I don't want to bother my doctor with this." Another mistake is not tracking symptoms systematically, which can make it harder to explain what's going on. Without clear details, doctors might miss the bigger picture. A 3-minute checklist can be your first step to catching a serious issue early. Write down your symptoms, track them for 2 weeks, and don't hesitate to speak up at your next checkup. Regular physicals, every 6 months, are a great way to stay ahead, especially for those of us over 50. Your notes are your voice, helping your doctor connect the dots. I believe taking charge of your health starts with small intentional steps. For those of us over 50, a persistent itch isn't just an annoyance. It is a chance to listen to your body and act with confidence. Anna's story reminds me that a simple notebook can be a powerful tool, giving you clarity and courage to protect the years ahead. Time for family, hobbies, or just savoring a quiet morning. You don't need to be a medical expert. You just need to trust yourself. Now that you've got a simple way to check yourself, let us wrap up with a powerful reminder of why listening to your body matters and how it can give you more time for the moments you cherish. Stay with me for our final thoughts. Your body is always talking to you through a quiet itch, a subtle change, or a feeling you can't quite explain. But are you listening? Let's wrap up with a powerful reminder of why those small signals, like persistent itching, could be your chance to take charge of your health and protect the moments that matter most. We have journeyed through 5 surprising spots where a persistent itch could be more than just a nuisance. Your lower legs hinting at blood cancers like lymphoma, your upper back possibly pointing to pancreatic issues, your scalp where leukemia or skin cancer might hide, your chest or breast a potential sign of breast cancer or lymphoma, and sensitive areas like the anal or genital region where rare cancers could start. Each of these itches, though small, carries a big message. Your body is trying to get your attention. According to the American Cancer Society, catching cancers early, when they're most treatable, can boost survival rates to over 90% for some types. For those of us over 50, these quiet signals are easy to miss, but they're often the first step to staying ahead of serious conditions. Let me share one final story. Tom, a 72-year-old grandfather from Georgia, had an itch on his chest that he ignored for months, thinking it was just dry skin. But when his granddaughter noticed he seemed more tired during their weekly walks, she urged him to see a doctor. Tom mentioned the itch almost as a joke, but his doctor took it seriously, ordering a mammogram that revealed early-stage breast cancer. Yes, in a man. Today, Tom's in remission, back to playing catch with his grandkids. His granddaughter said, "Grandpa thought it was nothing, but that little itch gave us more years with him." Tom's story shows that listening to your body and acting early can change everything. The biggest mistake is letting fear or embarrassment stop you from acting. Many of us over 50 think it's just an itch or worry about bothering our doctor with something small. But waiting for bigger symptoms can mean missing the window for early treatment. I believe your body is your greatest ally. always sending signals to keep you safe. For those of us over 50, those signals might be softer, but they're no less important. An itch might seem trivial, but it could be your body's way of saying, hey, let's check this out. Stories like Tom S. remind me that taking action isn't just about health. It is about preserving time for family, laughter, and the simple joys that make life rich. Here's a quick checklist to carry forward. Check your skin monthly, note any itch that lasts over 2 weeks, and get a physical every 6 months. If something feels off, speak up. Your doctor wants to hear it. Acting early is the key to staying in control. Before you go, let's make this personal. Comment below with one thing you learned today, like this video, and subscribe to stay empowered about your health. Share this with someone you love. It might just spark a conversation that saves a life. Thank you for joining me, and let's keep listening to our bodies together.